Even with all the information surrounding PPE, there are a few behaviors I have been seeing regarding glove choice and proper use. So here are 3 do's and 3 don'ts to keep in mind when choosing your glove PPE. Do make hand hygiene a priority when donning and doffing your gloves. Hand hygiene is an essential part of the standard precautions that every healthcare facility should follow and is the most critical measure to prevent the spread of infections among patients and providers. Do choose gloves that fit each team member properly. It's so frustrating to wear gloves that are too big or too small, and it could create hazards. If the gloves are too big, the clinician could drop instruments, and if they're too tight, they could potentially cause debilitating musculoskeletal disorders. So gloves that are a good fit and ergonomically designed are essential for clinical team members. So be on the lookout for the U.S. Ergonomic Seal when choosing your gloves to ensure these products are designed to help prevent any long-term damage. The Microflex Ultraform line from Ansell is a great example of a product that delivers measurable ergonomic benefits by improving comfort and fit and minimizing the risk factors that may cause injuries. Do ensure the glove material won't cause an allergic reaction among your patients or your team members. Clinicians have historically used latex gloves. However, latex allergy has given rise to other materials such as vinyl or nitrile gloves, like these from Ansell. Each type of glove differs from one another, offering varying benefits such as durability, barrier protection, elasticity, and tear and puncture resistance. Don't remove your PPE before removing your gloves. When removing PPE, there is a specific sequence to help decrease the chance of cross-contamination. I often see professionals remove their eyewear or their mask before they remove their contaminated gloves. This means anything outside the gloves is now on your eyewear and your mask. Removing these items with gloved hands means you could touch your face with the gloves, allowing a transfer of pathogens from the patient to the clinician. Don't remove gloves and try to put them back on. Removing contaminated gloves before grabbing items in a cabinet or a drawer, it's important. However, when gloves are removed, even for a moment, to grab an object, the glove should be disposed of. Hand hygiene should be performed, and a new glove should be donned. Preparing armamentarium for each patient before donning gloves can help decrease the chance you would need to unglove and reglove during patient treatment. Don't wear gloves from a brand you don't know. There have been many supply chain concerns, and finding PPE has been challenging and sometimes impossible. Trusting your manufacturers to ensure the PPE your practice uses has a long history of proper protocols helps to prevent infection control breaches. All dental clinicians should be trained to select and put on appropriate PPE and remove PPE to reduce the chance of skin or clothing contamination. I hope these do's and don'ts were helpful and a reminder to keep patients and your fellow team members safe from cross-contamination.